Are there different ways to treat childhood scoliosis? Having a child diagnosed with scoliosis and how you respond to that diagnosis is one of the key decisions that must be made regarding the treatment of your child's scoliosis. Different treatment approaches really offer different potential results and really could be a difference between a fused spine and a non-fused spine is just this decision. Parents and caregivers have to choose between surgical and non-surgical treatment providers. And really the treatment provider that's managing your scoliosis really could dictate where you end up. A childhood scoliosis should always be taken seriously. This is because we know scoliosis progression is triggered mostly by growth, and the most common progression is adolescent growth spurts. And at this stage, curve progression could happen very quickly, and the situation could change very rapidly for patients. So looking at this time and making this decision is one of the most important things. Now, by default, most scoliosis patients are managed by orthopedic surgeons. Orthopedic surgeons typically divide scoliosis treatment into 3 phases. Mild scoliosis cases are typically not treated, meaning there's nothing recommended for these patients. Now, when people hear the word mild, they think small problem. But mild in this case means not big enough for surgery. It doesn't mean that the curve will not worsen. It doesn't mean the curve may not progressively become severe. It doesn't mean the patient may or may not have pain. It just means the curve by size is considered too small to have surgery. Once curves become 25 degrees but are less than 40, if the person is actively growing, the orthopedic surgeon may consider a brace at this time, and typically they use a Boston brace to try to slow down the progressive nature of scoliosis during this growth phase. But if the person is not actively going through puberty, there is no treatment recommended at this time. And then if the curves get larger than 40 to 45 degrees, now they call scoliosis severe, and now they start considering spinal fusion. So for the orthopedic surgeon, the end treatment is spinal fusion. Very little is done before that. You can see for mild curves, nothing is done. Moderate curves, only during puberty, they're using a Boston brace to try to slow it down. And then if the curve becomes severe, it's when they consider spinal fusion. And this is where they fuse the entire spine together from the most tilted bone of the top of the curve to the most tilted bone on the bottom of the curvature. They use metal rods and screws to hold the spine. They use bone grafts in between the bones to try to take place, and the spine becomes one solid bone where the curvature was located. Fusing the spine does tend to straighten the curve at some level. It doesn't cure the scoliosis because we don't know what caused it. It won't make the spine perfectly straight. It will reduce the size of it, but there's some serious costs associated with spinal function, meaning now the spine is no longer going to move or bend. It can affect the overall health and strength of the spine. We know fused spines potentially could be weaker and more vulnerable to injury. They could experience a significant loss of spinal motion, flexibility, and pain are all associated with spinal fusion. So it's a significant thing to consider. When we look at non-surgical approaches for children, we know conservative approaches are definitely more proactive. And when I think conservative approaches, I mean modern conservative approaches, not just conservative Boston bracing, but I mean modern proactive conservative treatments that typically combine many treatments. And conservative treatment typically has the goal at preventing progression before it happens, and it's decreasing the likelihood of increasing effects of the scoliosis causing more issues, and therefore we want to decrease the need for invasive surgery. So modern conservative treatment normally would treat curves at smaller numbers where traditional approaches may not. And these non-surgical treatments are really started as close to the time as diagnosis as possible, and we integrate many types of scoliosis-specific treatments capable of impacting the scoliosis on many different levels, not just a Boston brace to slow it down. We can use chiropractic care and chiropractic adjustments. We can use physical therapy, physical traction, rehabilitation, vibration, percussion therapy, scoliosis exercises, corrective bracing, rehab. And we use all these things in a way that they all work together to, number one, reduce the curve size. We must reduce the curve size because as the curve gets bigger, the curve itself getting bigger is the reason why curves continue to progress. Because as curves get bigger, they're more likely to get bigger. So we want to reduce the curve size. We want to strengthen the spine surrounding muscles and tissues, and we want to improve the overall body shape and symmetry. If we can do this, we really can affect the progressive nature of scoliosis. We know scoliosis affects children at all ages. Unfortunately, babies can be born with scoliosis, and we call this type of scoliosis congenital scoliosis. We know young children or young infants can be diagnosed with scoliosis, and this is called infantile scoliosis. And this is normally diagnosed between 6 and 3 years of age. And the most common type is congenital. It means they were born with it and they just found it a few months later. But the second most common type is neuromuscular scoliosis. Juvenile scoliosis is scoliosis that starts to affect kids between 3 and 10 years of age. Now, we honestly believe almost every case of scoliosis starts in this group, but it may not be diagnosed, meaning it doesn't become big enough for them to see it. And normally these patients are diagnosed because they have an x-ray for another reason. Maybe they get they have a chest x-ray, or they're having pneumonia and they get an x-ray, or they have some injury and they get an x-ray and they see a scoliosis occurring. The most common type of diagnosis is in adolescence, because this is when patients are going through pubescent growth spurts, and during the growth stage is when the curve worsens or has the potential to worsen quickly, and this is between ages of 10 and 18 years of age. Now, the most common age of diagnosis, like I mentioned, is that adolescent stage, and the most common type is something called idiopathic, meaning we don't know why it's happening, but adolescents are at the risk for rapid progression because of rapid growth. And what happens is the curve may not change when patients are not growing, and patients get a false sense of security. They may say, oh, the curve isn't worsening, and then boom, they go through a rapid growth spurt, and the curve can change really quickly. I've seen curves change 20 degrees in 6 to 8 weeks. I've seen kids go through rapid growth, and things can change very, very quickly for patients. So we never want to take scoliosis not unseriously until they're fully grown. Once they're fully grown, the risk of progression rapidly decreases because the growth rate has rapidly decreased. Now, scoliosis progression means the curve is getting bigger, right? And now we know the curve can get bigger really at any age, but it's more likely going to happen during this rapid phase. Now, as a curve progresses and gets bigger, it's more complicated, and it's more severe, and it's more difficult to treat. I mean, I want you to think about this one thing. 25 degrees or less, mild curvature, orthopedic surgeon does nothing. 15 degrees difference, 40 degrees, they want to put a rod in your spine for the rest of your life. And that's 15 degrees. 15 degrees during adolescence could happen in a very short time, 3 to 6 months, right? So we got to understand that this could change very quickly right in front of your eyes, even in between trying to find appointments. I find people, they go in, they get diagnosed with scoliosis, say it's 25 degrees, then they're recommended to go get a Boston brace. Sometimes getting that appointment could take 2-3 months. They go in and get a Boston brace fitted, then they get their made, they go back to get it put on, they have to go back to the orthopedic surgeon to get an x-ray put on. That could be 6 months, sometimes has happened, and their curve has worsened during that whole time, and now they're severe, and now they're recommended surgery. It can happen that quickly. So therefore, the way you treat and the way you manage this for your child can have a devastating effect on their health or a very positive effect on their health if it's managed properly. So there is never treatment guarantees, but when it comes to children, early detection and early intervention are the highest things that are associated with treatment success. Meaning, if you find something early and don't treat it and let the curve get bigger and bigger and bigger and bigger, the likelihood of there being treatment success tends to go down, and now you're looking at surgical intervention. Now, most of my patients I treat are 60 degrees and they've been told they have surgery, and we're trying to reduce their curve below surgical threshold. We're very successful at doing that. However, I much rather treat much smaller curves because there's much less limitations. We know scoliosis is uncurable, right? We can't cure what caused it, but we know we can treat it. We know we can reduce it. And by making the curve smaller, we're reducing the very thing that's causing it to worsen. And what's causing it to worsen is as the curve gets bigger, it's more likely to. So the best scoliosis treatment you can have for your child is an approach that's proactive and aligned with treatment expectations that are to reduce the curve and prevent surgery. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.